You know, there's this entire hidden world of fungi thriving in the soil, pretty much totally unseen. But what if a single breath, one single unsuspecting breath, could introduce one of them into your body? And what if it just stayed there for years, like a silent passenger, just waiting?
Hey everyone, welcome to MediByte, where we try to make sense of complex medical topics. Today, we are opening the case file on a really fascinating fungal infection, one that can be traced back to a single breath you might have taken years or even decades ago.
It honestly sounds like something out of science fiction, right? But this is a real thing. The idea that a single breath from your past could cause a health problem that only shows up much, much later in life.
Okay, so here's our game plan for today. First, we're going to identify this invisible fungal invader. Then, we'll pinpoint where it hides and who's most likely to run into it. After that, we'll get into the signs and symptoms, how doctors figure out you have it, and finally, the most important part, the path to recovery.
All right, first things first, let's just get this name out of the way. Paracoccidioidomycosis. Yeah, it is a mouthful, I know. So what in the world is it?
To put it simply, it's an infection you get from a fungus called Paracoccidioides brasiliensis. Now this is super important. You can't get this from someone else. It's not contagious. It's an environmental fungus, which means you find it out in the world, specifically in the soil.
The way you get infected is actually pretty simple. So picture this, the fungus is just hanging out in the soil, making these tiny little spores. Then, when the soil gets kicked up, maybe by farming or construction, those spores get into the air, and the infection starts just by breathing them in. That's it.
So where on earth does this fungus live, and who is most likely to come across it? Let's take a look at the geography and the people most affected. See, this fungus is a bit of a homebody. It's not just everywhere. It has a very specific habitat, the soil in certain parts of South and Central America, with a real hot spot in Brazil. And that specific location, well, it becomes a huge clue for doctors trying to make a diagnosis.
So who's the most at risk? Well, the data shows a pretty clear picture. It's typically men, usually between 40 and 50, who work in farming and are around soil a lot. But here's the part that might surprise you. It usually infects people who have a healthy immune system. It can affect people who are immunocompromised, but believe it or not, that's actually less common. Now we're getting to the real mystery of it all. What happens after someone breathes in these spores? For a lot of people, the fungus just becomes, well, a silent resident. And this, right here, is probably the most important thing to get about this infection. For the vast majority of people who breathe in these spores, absolutely nothing happens. Their immune system gets it under control, and the infection never causes any symptoms. They might not ever even know they were exposed to it in the first place. So you've got two main roads this can go down. The most common road, by far, is that your immune system handles it and you get zero symptoms. But in a smaller number of cases, symptoms do show up. They can look a lot like pneumonia. We're talking cough, fever, feeling short of breath. Painful sores, especially around the mouth and nose, can also be a telltale sign. And this is where the timeline gets just wild. The gap between breathing in the spores and actually feeling sick isn't days or weeks. We're talking months or even years. The fungus can just lie dormant, totally quiet, in the body for an incredibly long time before it decides to wake up. And here's another really important piece of reassuring news. Even when symptoms do show up and stick around, the source material is very clear. This infection is very rarely fatal. Okay, so let's say a patient has these symptoms, and they've traveled to one of those regions we talked about. How do doctors nail down the diagnosis for sure? Let's walk through that process. It's a really methodical approach. It all starts with a physical exam, of course, but to get the final answer, doctors will take a tiny tissue sample, maybe from a skin sore or from the lungs. They then look at it under a microscope to literally see the fungus, and they'll also try to grow it in the lab. That's called a culture. Blood tests can also help seal the deal and confirm the diagnosis.
All right, we've identified our culprit, we've confirmed it's there. That brings us to the final, and let's be honest, the most important chapter in our case file, the path to recovery.
And the news on this front is overwhelmingly positive. This isn't some untreatable medical mystery. There's a clear, effective treatment plan that uses well-established antifungal medications. Doctors have a really solid toolkit to fight this. The main drug, the one they use for most cases, is called itraconazole. You can think of it as the first line of defense. Now, for the really severe, life-threatening cases, they bring out the big guns, a powerful drug called amphotericin B. And there are other medications, too, that can stop the fungus from growing and just help the body heal itself.
So we can close the case file on Paracoccidioidomycosis. It's just a powerful reminder that there is this incredibly complex, hidden world of biology right under our feet. It really makes you wonder, doesn't it? What other medical mysteries are just waiting for us in the soil?
If you found this medical case file helpful, do us a favor and hit that like button. Share it with anyone you know who loves a good medical mystery. And of course, subscribe to MediByte for more deep dives. Thanks so much for watching.